I would like to take this opportunity to welcome all of you. I'm sure Sonia will be joining. She's there. Sonia?
Yes. Hi.
You're welcome. Let me quickly do the running order. We have the Honorable Minister for Gender, the first to log on. And then we have Mami Kari again, also on. We have Fatima is actually the host. And I'm supposed to be doing this, was supposed to do the welcome address, but unfortunately, my wife who is supposed to do this is bereaved. So she asked that because I have some clothes, some gene of some feminine destiny in my blood, I should just step in for her. So I'm doing this. So you see me as one of yours. I'm one of you. Today, I'm one of you. So yes, so we have Radhika is also there. Radhika, thank you for joining. We have Uli Keita online. We have Nancy Best here. And I would like to say a very big welcome to all of you. The Honorable Minister has a very tight schedule. She's supposed to be in a meeting at the Office of the President. And so I will introduce her quickly so that she goes. But I would like to say that we all know that we are facing a very hard time with this COVID-19. And the situation is further aggravated in Africa with limited health and economic infrastructures in place. And the impact of the COVID-19 on African women and girls who continue to face economic injustices is significant and quite overwhelming. And so the pandemic has added to the existing structural injustices, creating a far deeper social and economic humanitarian threats to our mothers and young girls. I would like to welcome Mama Duncan to the team. I would like to inform you that we are streaming live on Facebook Live. We are streaming live. Some media houses are picking the feed live, and we are streaming live also on YouTube. And we'll be very happy that we stick to the running order. So I'll quickly just go straight to introduce the Honorable Minister for Gender, who will be speaking to us on food insecurity as a result of COVID-19. But before she takes her turn, let me just give you this brief introduction.
Cynthia Mamle Morrison, born 17 January 1964, is a Ghanaian politician and member of the New Patriotic Party. She is currently the Member of Parliament for Aguna West constituency.
Honorable Cynthia, please, you have the floor.
Good morning, everyone. Good afternoon, everyone.
Good afternoon.
You can hear me?
Yes, we can hear you loud and clear.
Yes. I'm so glad that we are doing this afternoon. And we are praying that COVID will leave so that we can see ourselves together whilst we do programs and not COVID programs. In Ghana, the devastating efforts of COVID-19 pandemic on women, girls, and children cannot be glossed over. It has eroded a lot of gains of the already vulnerable categories, with the highly hit being women, children, and the aged and persons with disability. Data on these groups in developing countries continue to be a huge challenge owing to the cost of gathering such information, maintaining the systems, and constantly updating such details. In Ghana, the pandemic brought to light where these groups of people who have slipped off the poverty line may be, and with the support that it can be provided for them. Specific areas that were largely affected include gender mainstreaming and women empowerment. All sensitization, capacity building, and the he for she activities have been suspended due to the COVID-19 pandemic. Sensitization to support female parliamentary candidates is negatively affected and likely to reflect in parliamentary election results. Also, there is a likelihood of an increase in teenage pregnancy since schools have been closed and children are at home, while their parents work to provide for their daily sustenance. Gains of gender equality in education is also at risk due to the reports of parents and their guardians overburdening girls with household chores, denying them access to online teaching. But the gender-based violence has been reported to have increased, while available data show a drop of maternal care services, antenatal care services, because of fear of contracting the COVID virus if they go to the hospital. Government has, however, introduced online classes for children, as well as using TV and other media sources to educate the general public about the COVID-19. The President of the Republic of Ghana, His Excellency Nana Addo Dankwa Akufo-Addo, has constantly briefed Ghanaians on current updates of the disease, interventional measures put in place to combat the disease, and appealed to the general public to abide by the preventive protocols. Government has provided financial relief to the private sector. All government workers are routinely paid their monthly salaries as planned. Child right protection and promotion. The economic hardship experienced by families could also result in incidents of child malnutrition, especially in poor communities that were supported by the social intervention programs. For example, the school feeding program, as they will not be able to have access to the one hot meal a day. Studies indicate that lockdown comes with heightened risk of children witnessing or suffering violence and abuse. The prolonged confinement of people to their homes can exacerbate the incidents of violence against children, as children would not be able to go out and report violence perpetrated against them, and as such, suffer in silence. We have, however, advertised our hotline numbers, Helpline of Hope, where everyone, including children who are experiencing any fear or difficulties, can call for help. Government provided food for the vulnerable during the lockdown, and there are plans to provide raw food for such families. School feeding. Because schools were closed down, caterers suspended cooking, and innovative nutritional training, which was initiated with the objective of improving the quality meals prepared for the school children, was put on hold. Government is, however, working with the World Food Program. Can you hear me?
Yes, we can hear you. Go ahead.
Government is, however, working with the World Food Program to provide raw food for such families. Also, government is going to feed all the junior high final year students who are writing their final year exams, including their teachers. Social protection. The pandemic has created major problems, especially the livelihood of the extreme poor and vulnerable. Wow. The Ghana National Household Registry.
It looks like the network is not on our side. I mean, it's not being friendly to us again. But we can quit the video, Honorable, so that you could have the signal strength that is required.
Okay.
If that will be okay.
With the leave, the ministry has set up an emergency responsive social protection system to protect and support the poor and vulnerable during the pandemic, to ensure that the emergency relief items are distributed to the vulnerable groups, kayes, street beggars, destitute families on the streets, people living with disability, in the transparent, and accountable manner. We have successfully completed data collection in the Upper West and Upper East regions into 2017 to 2019. Data collection in 3 regions, namely Northern, Northeast, and Savannah regions, have been negatively affected by the emergence of the COVID-19, but is currently ongoing. The livelihood empowerment against poverty. The LEAP program currently provided a bi-monthly cash grants to a total of 1,451,656 individuals, comprising of 796,914 female, that is 54.9%, and 654,742 males, that is 45.1% respectively. The COVID-19 pandemic, with the accompanying social distancing measures and other safety requirements, have impacted negatively on the disbursement of funds to LEAP beneficiary households. And so to address this, 2 cycle payments were made to the LEAP beneficiaries at once, and a top-up added to them to enable them move to the cash points to collect their monies. The disability and the aged, persons with disability and the aged were supported with uncooked food items during the lockdown. There was a very strong collaboration between our ministry and our development partners, civil society organizations, the private sector, individuals, government institutions, and the government at large to fight this disease. The ministry collaborated with the Food and Drugs Authority to produce and distribute 17,000 bottles of hand sanitizers to head porters, carriers, street persons, people with disability, identifiable vulnerable groups, Widows Association, Veterans Association, Helpline of Hope Callers, Children's Home, female porters, and security agencies. The ministry collaborated with the district assemblies and the National Disaster Management Organization to prepare and distribute uncooked food to over 2,500,000 vulnerable persons in the Greater Accra and Ashanti region during the lockdown period. The ministry also distributed uncooked food in locked communities to vulnerable individuals and groups such as head porters, people who call through their toll-free hotline number, persons who worked in National Council of Persons with Disability, persons of the cerebral palsy, other disability groups, and to amputee people living with HIV/AIDS, mothers to children, transmission of HIV groups, widows, aged people groups, NGOs, on behalf of target groups, foster families, rehabilitated homes, shelter and abused persons, street children, various constituencies, opinion leaders, Asafoche, Gamache, Palace, Osumanche, Palace, and all that. The Ministry of Gender, Children and Social Protection intervention are to support governments mitigate the accompanying negative social and economic impacts of COVID-19 on the lives of the extreme poor and vulnerable through the implementation of responsive emergency social protection assistance in times of crisis. The impact of the interventions on the people has been very positive, and we all continue to strengthen us during this post-COVID-19 pandemic. I thank you very much for your attention.
Thank you very much, Honorable Minister. Because you'll be going for a meeting with the His Excellency, the Office of the President, I would want to just quickly ask you some few questions and then also open the floor for the panelists to also engage in some of the things that you've said so that you don't miss anything. It has been in the news that some women have suffered some violence, even in the midst of this COVID-19, for being, accused of being witches and all of that. And I know your ministry is in charge of that. Can you tell us, what is this all about? And what has been your, what has been the intervention or the support that you would want to give to such vulnerable women? I mean, you know that they have this tension. You mentioned that, I mean, being confined in their homes and all of that comes with its own nuances. Then it is coupled with this person being lynched and losing the life. I mean, what is your take on this, and what are you doing about it so that it can serve as a lesson for all of us on the block?
It is unfortunate that this is happening this day and age, but it did happen. My ministry immediately went to the north, Kafaba, where the woman comes from, to have a first-hand information on what actually happened. And so we are putting a law in place that never again can this happen. I just sent a letter to the Speaker of Parliament, the Select Committee on Gender. We are moving to the north on Tuesday to see the opinion leaders, the chiefs. We had a conference, stakeholders conference. The chiefs came all the way from the north. We had opinion leaders. We had reverend ministers. We had council of state. We had a whole lot of people come together to deliberate. So now we're moving to the north. On Monday, we're moving to the north. Tuesday, we have a meeting with them to ascertain the whole situation, because it happened at one place, but we believe it can happen at other places without our knowledge. So we are going to close down all the witches' camp. But when we close the witches' camp, there should be a safe haven for women who are in distress. And so we are turning some of our social welfare structures into a safe haven for them, and also to negotiate with the chiefs whether they are going to turn over the camps to us at a fee, so that we can rehabilitate the place to become a recreational center for women, so that if somebody is abused, that person can run to that shelter, but not branded as a witches' camp, but to be a safe haven for women all over.
Fantastic. Thank you very much. So I would leave it with the panelists if you want to ask any questions, so that she doesn't escape any of your bullets. I would want to hear from you if you have any questions for her. I know Nancy will be telling us about a fantastic project she did with Millennium Promise in Uganda. I mean, having a bakery and all of that, and we are going to have practical solutions to some of the, I mean, problems that we are confronting the women, in particular, young girls, and all of that on this platform today. But I'll be very happy if I could get any question from you. I know there are a lot of, women in the front line, and they are being depressed. They are suffering a lot of, stress at this practical moment of, challenging times. So I would want to open the floor for any question from the panelists first, and if the participants who are online would want to ask the Honorable Minister. It's so difficult to get the minister, so once we get her, we get the best out of her and then leave her to go so that we can continue with our discussion. So please, I'll open the floor for any questions that you may have. You are free to unmute and then ask her the questions you would want, and then she can be let go now. Yes, so, Sonia Sachs.
Honorable Minister, I don't have a question. I just want to tell you how deeply impressed I am with your presentation and the work that you have described. Do you know that in the United States, there is not a single official that has given this kind of strategy, a comprehensive strategy for social protection of the people in the United States? You really are an icon for me. And I just want you to know that what you're doing in Ghana is absolutely amazing. And I just wish you were in the United States leading the effort for this country. So thank you, and our respects and high regards.
Thank you, Sonia. I'm so grateful.
Thank you. Thank you for your kind words. You know, at this point, then I tried to identify with her. In fact, I'm humbled to say I'm a special advisor, one of her advisors.
That's right.
And so, yes, I attach myself to that. So if she were to be in the United States, I would have been there also to, I mean, compromise it. Great. Nancy,
Yes.
would you want? Yes, great. Go ahead, Nancy.
All right. I think you've got a presentation. Can you put that up on the, can you do a share screen or not?
Yeah, we'll send it. We'll send
Yeah,
it
you
to
can go
everyone.
ahead and do your share screen, please, Nancy.
Okay, great. So probably 2016, 2017, I had taken another trip to Uganda and was asked once again to help provide supplies for the girls' schools. And I realized that I could help this year, but next year they would ask me for the same amount of money, and the next year and the next year. So I wasn't really doing anything to help sustain that girls' school. So I asked the sister if she would come up with some ideas that the girls could do that would generate income and help make it sustainable. So they came back with about 3 or 4 ideas, all vetted, and we worked them out, and they decided that a bakery would make the most sense. There was not one in the village. There's a hospital in the village. There's a market. So they had a place where they could sell the bakery goods, as well as a girls' school of 800. They could use the products themselves and not have to buy bread from far away. So we embarked on that project. The mission was to develop and implement a strong business model that makes the bakery a sustainable enterprise and optimize its impacts on the education of the girls. And boarding school, there's the first slide with the business model. And then this second slide, the boarding school is one of the most impoverished areas of Uganda. It has a population of about 800 girls. And the bakery business specifically addresses the challenges and constraints preventing girls' access to education. The bakery is used to train girls on baking and pastry. And upon completion, operations and control were transferred to the school management committee. And this committee is led by the headmistress, Sister Noella Berenji. And she is wonderful and enthusiastic about the project. Originally, some people thought it should be an outside group with control, but I felt like for it to be absolutely owned by the school and be sustainable, the leadership of the school had to have control of it. And so that's what we did. Then you have pictures of the bread and the girls, and then I am there when we first opened the bakery in the beginning, and that was exciting. But the school management team looks for market opportunities for the bakery products to sell them. And they're in charge of developing a training plan for the school girls. And we have, they identified 3 people in the school to do the training and work with the girls, and then to have the girls take it over. But this business enterprise offers a sustainable source of funding to provide the necessary financial resources which are needed to acquire the scholastic materials and other essential needs for the most vulnerable girls in the school. So this is just one idea that we did, that we implemented to help them help themselves, which I think, I mean, for me, that's my goal, is to give them the resources and the wherewithal so they can go on and soar on their own. So it's been a happy project for me, and I think for everybody there. And I think, you know, it's happy to see that it's completed.
Great. Nancy, that's
Yeah.
fantastic. That's fantastic. I think, I mean, it's phenomenal. I must admit to you that you can charge me for plagiarism because I'm going to try my best to get this innovative idea duplicated in Ghana. Because, I mean, I told the Honorable Minister, who was so head over heels in love with your model, which is so sustainable, that yes, we would want to duplicate this in Ghana. But you know, in Ghana, when we are doing everything, we do it big. We try to scale it. And
Yes.
so, whereas you've done it well, and we have the records to prove that it is scalable, and the Honorable Minister is here, and we have had discussions that we would want to adopt this model in the country, to duplicate it across the country. Every region is going to have at least one such innovative, wonderful bakery across the country, because we all eat bread, and we want, you know, and I mean, she's in charge of school feeding, and she's very modest in everything that she does, I must admit here, because if she says she's going to tell you the kind of interventions that she's managing in the country, I mean, she will take forever on this platform. But I'm telling you, you are doing fantastic work, and we would want to adopt it in the country. So at this point, I'll move straight to Sonia, who is another modest person, but just so she doesn't try to hide anything, here we go.
Sonia L.H. Sachs, research scholar. Sonia L.H. Sachs is a pediatrician, an endocrinologist, and public health specialist. Since 2005, she has been leading efforts at the F Institute, Columbia University. Since 2005, she's been leading efforts at the F Institute, Columbia University, design and implement low-cost primary health systems in low-income rural Africa and India. Her focus is on systems delivery, primarily for maternal and child health at local to national scales. Dr. Sachs coordinated the health sector with the Millennium Villages Project, overseeing all health-related interventions and research.
Thank you, Chief, for the gracious introduction. I just want to, before the Honorable Minister leaves, I just want to make sure that that she hears me say that despite the small glitches of technical issues, it is really remarkable that that this kind of a panel can take place, and that we get to hear from you, Honorable Minister, of your incredible work. And so, you know, it is really worth all the glitches because we heard you loud and clear, and we admire the work that you do. And Chief and your Millennium Promise team, I appreciate your convening this group. Millennium Promise, thank you. The Millennium Promise Alliance has dedicated itself to improve the lives of women and children in rural communities of sub-Saharan Africa, first and foremost to improve their health and to decrease maternal child mortality, which is unacceptable. Although there is progress, the continent still suffers from avoidable premature deaths. It still suffers the three epidemics of AIDS, TB, and malaria. And as a matter of fact, there is a threat that these are now resurging, that there's still a lot of avoidable premature death. The three epidemics from the previous century are still unfortunately present, and unfortunately seem to be threatening to rear their ugly head more now. And we've just watched the devastating outbreaks of Ebola, and now here we are facing a potentially enormous consequences of this new epidemic. We don't know yet how intensively the pandemic will impact Africa. The success of controlling this epidemic depends on the approach by each government. We've seen how some countries like Taiwan, China, South Korea have mounted an organized, robust public health response and are able to contain the epidemic. On the other hand,
Sorry.
Yeah, if it's possible, maybe, oh, good. Yeah, I was just hoping that those that are not um, trying to correct me are mute until they want to correct me, which I welcome. My point is that there are some countries that exemplify the fact that this is a surmountable epidemic. And then there is the US, where we're unfortunately witnessing an incoherent approach leading up to currently 160,000 deaths. And of course, the number is still climbing. So clear, focused policy makes a huge difference, which is why it was such a wonderful news to hear the approach of the Honorable Minister. And as I will briefly explain, to combat this epidemic, community health workers, who most of the time are women, community health workers are an essential component. What's not well understood, at least in the US and in Europe, is that the focus of suppressing this epidemic has to be a public health strategy. The medical, technical, hospital-based treatment is important, but it decreases the case fatality ratio. It decreases the number of deaths of people who've already been infected. But that, the hospital treatment, does not stop the number of people getting infected, and therefore it will not stop the epidemic. So it's the public health strategy approach that's crucial, and for that you need health extension workers. Strangely, in the US, as we're really sadly witnessing, this took months and months to understand. Public health has been dismantled. As you know, the CDC has really been in decline for the last 2 decades. And the public health approach to the epidemic still has not been focused and acted on. The focus still is on the hospital capacity to handle the very ill, but less focus on suppressing the virus. Public health and well-trained health extension workers is not happening at the scale that it needs to be. I want to quickly review the 6 or 7 points that are crucial to suppress the COVID epidemic, to suppress the virus. And it makes, when I review these 6 or 7 points, it'll make clear why health extension workers are crucial, because it's the health extension workers that educate the community on the prevention, they educate the community on the identification, and they educate the community on the response to the virus. And the health workers are the link to the medical arm of the health system. They are there in the community, embodying the link between the households and the medical establishment. So what needs to happen to suppress the epidemic? First and foremost, we need to encourage and facilitate testing. You need to identify the infected people. Even if testing is not available, you can identify them by the collection of symptoms. And that's good enough if you don't have testing kits. So testing or symptomatic identification. Number 2, you need to trace all the contacts of the identified infected cases. And you need to, for that, you need to interview the infected person so that you know whom they may have whom they were in contact with and may have infected. For that, you need health extension workers in the community. You can't do that in a hospital. So the second point is contact tracing. The third point is immediate isolation or quarantine for the people who are symptomatic, or the people who are not symptomatic but test positive, even if they're asymptomatic. And you need to quarantine also all their contacts. The isolation versus quarantine is you can isolate people at home if they have separate rooms in their household, or if there's somebody to help them provide food. And if those are not able to be in place, you need to actually quarantine them in a hotel or some facility for safety. And this too requires health extension worker. The medical establishment, hospitals and clinics are useless in that. The fourth point in responding to to the COVID virus, is personal hygiene, availability of hand washing areas, masks, and personal protective equipment, which is something that Millennium Promise Ghana is really leading on. The fifth point is to educate the community on physical distancing. By the way, I would like to, I'm following the WHO, I think, renaming from social distancing to physical distancing, because I'd like us to be socially very even closer together than before, like we are doing right now, but physically distancing the 6+ feet apart from each other to interrupt the virus from jumping from one person to the next. The next point, the 6th point, is testing and quarantining incoming travelers at the borders to the country. And that's something that Millennium Promise Alliance is really pioneering. As some of you know, they have designed and implemented the thermoscan at the airports and other borders of entry to Ghana. And it's really exemplary. They have a thermoscan, people walk through, are identified if they have fever, they answer digital, on a digital tool, they answer questions to identify potential infected people and to be able to trace them afterwards. Bravo, Millennium Promise Ghana.
Thank you.
And the
Thank you.
7th point is, and this is again an extension health worker role, is to put in place safe workplace practices by employers for their employees. This is also not happening in the United States. Famously, there have been many cases of viral infection in factories and meat production facilities. But safe work practices are important. Employers need to practice physical distancing, cleaning of the surfaces, encouraging gloves, hand washing, and masks. And they should be monitoring the employees for symptoms and respond appropriately to those that are symptomatic or those that are testing positive and those they were in contact. And the last point, which also relates to why community health workers are important, is for the control of the epidemic, which is something that my husband Jeff is working against big obstacles here in New York. You need real-time data. You need to know where the cases are. You need to keep track. You need to know where the clusters are. You need to know if they're coming from outside of the country and therefore do something about that. Or if they're coming through the community, how is it spread through the community? Check on the congregant settings like dorms, dormitories, prisons, nursing homes. These super spreader events like large gatherings, like sport events, church gatherings, parties, schools, etc. You need data to identify these clusters, these outbreaks, so that you can respond immediately. And having this data is crucial, and community health workers with a cell phone have become a crucial part of this. All of these interventions take place in communities outside of the clinical facility. So you need outreach as an extension of the doctors and nurses. And so community health workers can perform these life-saving duties. Usually we think of community health workers as being a substitute for where there are no doctors or nurses. But community health workers also have an absolute advantage, complementing the doctors and the nurses as they're performing these functions. Let me take a step back for a moment to review the concept of the professional community health workers, which has been exemplified by Millennium Promise Alliance in its flagship initiative called Millennium Villages Project, which was a proof of concept of the feasibility of communities reaching the Millennium Development Goals. And it took place in 10 countries of sub-Saharan Africa, in very remote rural parts of those 10 countries. There was a holistic approach to increase access to food production, health, education, infrastructure, business development, and other issues like gender equity. I was involved in working with the communities to design and implement a health system in these remote rural communities. And just in a nutshell, the health system, the crux of it was one clinic servicing 1,000 households, which is 5,000 people, one clinic that's within 2-hour walking distance of each household, and that provides the primary care and that ensures safe newborn delivery. So skilled birth attendants were crucial, and transport to a referral hospital if their complication is also crucial. But an important part of the system that we built out in the Millennium Villages Project was, and we've demonstrated this and have been since then advocating for, professionalized community health workers, one community health worker to 100 households. Because it turns out we have learned by watching what happens in these communities, we have learned that community health workers can really help with 10 most life-threatening entities, divided into these 3 categories. Malnutrition, which underlies half of the unnecessary death of children. Malnutrition. The second thing is they can really make a difference in identifying, diagnosing, and treating diarrhea, pneumonia, malaria, other parasites, worms, and all the immunization preventable diseases. And they can also help with safe pregnancy and birth preparedness by facilitating access to safe childbirth clinics. To define the professional cadre that we're advocating for, the professional CHWs, as demonstrated by Millennium Villages Project, professional CHWs are local women, secondary school graduates that live in the community that they serve. They should be selected by the community, meaning that they're trusted by the community. They obtain a quick training, typically 3 months, but then ongoing supportive supervision, which is like continuing training. They should not be volunteers in an ideal scenario. The volunteer is just only because of the finance for the resource depletion, but they should be remunerated. They should be properly paid. There should be a livelihood so they can really be fully engaged and held accountable. They need to be linked to a clinic, and they need to be properly provisioned with the diagnostic tools, like the usual tools that our community health workers had, which is rapid diagnostic for malaria, measurements for malnutrition, the mid-upper arm circumference, etc. They should have some treatment commodities like those needed for diarrhea, oral rehydration solutions, zinc, paracetamol, antimalarials, antibiotics, and the game changer, smartphone. All of the community health workers should have a smartphone with the app that we use, which was ComCare, or the app that the Ghana team adapted for Ghana use, which is C-Tracker. The smartphone is a game changer. It provides 3 crucial things. 1, it helps with decision support at the household, that the community health worker can check what he or she is supposed to be doing at the household, given that there's a pregnant woman or a 2-year-old child. By doing that, by providing decision support and by the GPS that the phone does automatically, the manager has real-time data. And so the manager can use that to adapt the interventions in real time. So the manager can see what the CHW is experiencing. They can adjust the household ratio that the CHW, the ratio that of panel of households that the CHW is servicing. They can adjust the supply chain. They can adjust the training of they can adjust the training of the community health worker, etc. And then the third point of a community health worker with a panel of 100 households and a smartphone is that the community health worker has the ability to surveil for emerging diseases. If the data on the phone shows that all of a sudden there is an increase in the number of cases that week of bloody diarrhea or some other symptom, in the case of Ebola, if the community health worker were in these communities and the 3 or 4 countries that were hit by Ebola, the managers would have immediately seen that there is an increased number of symptoms suggesting Ebola, and the outbreak could have been immediately attended to by technical teams instead of it spreading and becoming an epidemic that wasn't really addressed until there were literally dead bodies piled up in front of clinics. So surveillance for emerging diseases is a crucial and an absolute advantage of community health workers working within 100 households, knowing those households really well and noticing the new symptoms, and if possible, using a cell phone to actually document the data. And so community health worker can really be very crucial to identify small outbreaks before they become major epidemics. So community health workers are crucial for detecting early symptoms of an epidemic when it's just an outbreak, and they're crucial for containing the epidemic because they're trusted by the community. So when the community health worker gives recommendations to the community, they're more likely to be accepted. The horrific counterexample to that is what we all remember happened in Guinea, where when there were Ebola cases in the villagers, well-meaning, well-intended, well-provisioned public health practitioners came from the capital to help advise the villagers. But they, of course, the villagers didn't know how to react to these unknown people with hazmats, and actually attacked them and even killed some of them. So the trust of the community health worker is crucial to both finding out that there is potentially an outbreak, preventing it from being an epidemic, and then containing the epidemic. So with all of this experience, Jeff and I and Chief and others have started a campaign called 1 Million CHW campaign to advocate internationally for this cadre of professional community health workers to be a formal part of the national health system. It's the only way to achieve universal health coverage, which is our guiding post and goal. It's the only way. If you don't have the extension to the households, you cannot claim to have universal health coverage. Second is that they have a crucial role in epidemics. And third, and crucial aspect of community health worker is the job creation. It is the entry point of rural communities, women living in rural communities. It's the entry point into formal livelihood and jobs. The cost of having 1 million new community health workers in sub-Saharan Africa, we've estimated would be about $5 billion. We've estimated that half of that should be able to be provided domestically, so 2.5 billion, but that still leaves a gap of 2.5 billion for international partners to realize this dream of 1 million community health workers. And we could not raise it. We tried for years. We advocated for a fund for health systems. Of course, we have the global funds for ATB and malaria, which is great, but it's only for those 3 diseases, and it's only for commodities. There is no fund for health systems, including cadres like nurses and community health workers. We continue to fight that fight. Notably, Ghana 3 years ago did scale up nationally the community health workers. As you all know, they scaled up successfully up to 20,000 community health workers with be remunerated and with phones, with the application that helped their work. It was a pioneering initiative led nobly by the Youth Employment Agency, but tragically, as is the case in many places, no international partner stepped up other than Millennium Promise Ghana, but no other international partner stepped up to help Ghana, even as Ghana put this into place and put in very large domestic resources. There is progress in accepting the concept of professionalized community health workers. In 2017, UNAIDS, and by the way, separately and together, the African Union declared an initiative called 2 million community health workers mainly to combat HIV epidemic and to create jobs for women. Last year, another big step forward was the World Health Assembly passed a resolution that universal health coverage requires strong primary healthcare systems, and they add, for the first time ever, that strong primary healthcare system requires community health workers. And they call on all the countries to implement the brand new WHO guidelines for CHW programs. So all of these are new initiatives, but the problem remains that most countries in sub-Saharan Africa lack the funds needed for strengthening the primary healthcare systems, and they don't even necessarily have the smaller amount needed for the CHWs, which we estimated would be another $5 per person out of the health budget. But $5 per person, as small as it is a big increment to a health budget of some of the countries in sub-Saharan Africa. And there has been virtually no international support for these health system or for the community health worker programs. And especially now when it's urgently needed in face of COVID. And unfortunately, most donor countries and agencies are even more reluctant now than before because their own economies are in a downturn. So in summary, with the COVID epidemic, African continent, especially sub-Saharan African countries, face yet another new horrific epidemic, the magnitude of which we don't yet know. There are recent reports, tragically, that due to the effect of this coronavirus epidemic, there is a resurgence of the old epidemics, the HIV, TB, and malaria, because of unraveling of the existing systems. We heard from the Honorable Minister how some old problems that were actually overcome are unfortunately becoming a problem again. I would urge countries in sub-Saharan Africa, including Ghana, to apply urgently for emergency funds from the IMF and emergency funds at the Global Fund for AIDS, TB, and malaria. Emergency funds are urgently needed now for purchasing PPE, the personal protective equipment for healthcare workers to protect them as they are working valiantly to help the community stay alive. They are needed for scaling up. The emergency funds are needed for scaling up the numbers of community health workers, for the systems of identification of infected cases. The emergency funds are needed for testing, for contact tracing, and for quarantine enforcement. Again, I commend Ghana Millennium Promise Alliance for being a partner to the government on all of these issues. This current epidemic is very serious and needs to be addressed very vigorously. It's all hands on deck for governments and for their partners. And I'm proud that Millennium Promise Alliance in Ghana is one of those partners, innovating and contributing to Ghana's response to COVID by such thing as I mentioned, setting up the SermoScan and the digital tracking. And with help, they're also helping train the community health workers in the COVID response. And now Chief and his team, the Millennium Promise Alliance, is launching soon a program to obtain all the PPE, the protective equipment needed for health workers. It is indeed all hands on deck, and we here at least stand to lend our hand. Thank you, Chief Nat.
Thank you very much, Sonia. That was brilliant. And I must say that, yes, you nailed the whole thing very well. And I just want to add that the President of the Republic of Ghana has indicated in his last state's address on COVID that there's going to be a mandatory testing at the airports of entry. And we are creating a very fantastic station at the airport for, social distancing and also quarantining and isolation. And the testing will be done at the airport and the results will be rapid. And so that's just by way of information. We are still looking at the how and working with them to ensure that we get this done and done well. And I'll be sharing some of this with you in due course. So at this point, I would want to find out and then say that my co-moderator in the person of Fatima Bosu is on the other side. Fatima, I don't want them to say I'm being biased and taking the whole show. So can you let them hear your voice so that they know that I'm not alone in this one? Fatima.
Yes, you are not alone, definitely not.
We are together, right?
Yes, we are.
Great. So Fatima is going to moderate the second session. So I will do my last bit. I don't know if you have any question for Sonia at this point. I'll be happy to take that. And I must say we are streaming live on Facebook Live. We are streaming also live on YouTube. And we have some radio stations in the country taking it live also. And we have a lot of online bloggers also streaming live this particular session that we are having for the Women Economic Empowerment webinar, a series that we just started, and we're going to continue with it going forward. And I'm very grateful to all the panelists online today. So do we have any question for Sonia? And I'm very happy about the WHO definition from social distancing to physical distancing. It makes it very clearer now because I mean, social distancing was, creating some problems for us. So physical distancing makes much better, understanding. So Nancy, I don't know if you want to ask a question or make a contribution. Yes, go ahead.
I just want to congratulate Sonia because I've seen firsthand in many countries her community healthcare workers in action, and her little backpack that she designed with everything that goes in it for them to carry around, and just huge. The stunning of those children, all the wow. It's just congratulations, Sonia. Thank you.
Thank you. Thank you so much, Nancy. Thank you. You are a part of that. I'm sure, Nancy, you were a part of that. I remember the huge contribution you made towards the community health workers campaign. And I think that you also deserve some commendation for stepping up to support the work that we did together. We are so proud of you. Thank you so much. So at this point, I will do my introduction for my next panelist, who is going to talk to us about gender-based violence, peace, and women empowerment, and it's Uli Keita. So Uli, here we go.
Uli Keita, Director of Francophone West Africa Region, One Campaign. She's also the Program Coordinator at UNDP, Director of Program at Freedom House, Regional Partnership and Development Manager, Gender Focal Point at UNOPS.
Great. Uli, please, you have the floor.
Yes, thank you so much, Chief, for giving us an opportunity to do this. This is so important for all of us. So just building on Honorable Minister Morrison's presentation on the successful food security programs in Ghana, and Nancy's brilliant project on the bakery initiative in Uganda as a great example of sustainable women empowerment model that should be definitely scaled up, as you said, Chief. And I think Nancy, I just have to say this, Nancy is just very modest. She did so much more than what she actually mentioned. And I remember all her support during my time at Millennium Promise. She did so much with Sonia, and I worked with her and Sonia on all this. So just to say thank you for that. And of course, Sonia's intervention.
Yes, I don't understand why they are so stingy with the facts. I mean, in terms of the things that they do. Please, Nancy, we are so proud of you, and we thank you so much.
Absolutely.
So
and of course, Sonia's intervention on the Community Health Workers Program, which is absolutely brilliant and is successful, and it's very necessary, especially in these times of COVID, as the community health workers are definitely the links between the healthcare systems and the community, as she said. So all of these initiatives are women empowerment initiatives that are critical, especially in times of COVID. So what I would like to add here and emphasize on is that gender-based violence prevention, peace, security, and women empowerment are definitely critical in managing this global pandemic. I mean, we applaud governments all over the world as they have introduced a series of methods to cope with COVID-19, including the restriction on movements to mitigate the spread of the pandemic, as well as measures that they've taken to mitigate the economic impact. But notwithstanding all these efforts, the responses to the COVID-19 pandemic appeared to be very generalized, with relatively less attention devoted specifically to specific vulnerabilities of women. And this inattention from me to the gender aspect has heightened the impact of the pandemic in Africa, in Africa's health in general, and also in the economic security. So given the significant role women play in social economic development in Africa, disregarding the gender gap in COVID-19 responses has certainly exacerbated the already entrenched gender inequalities. We had issues, gender equalities issues before COVID, and COVID has just exacerbated it. In our societies, women are the primary caregivers. They provide care for the aged, the sick, the young, the whole family. and they perform a wide range of household chores. A significant number of health and essential service providers at the front line of COVID-19 response in the region are all females. Women are key actors in the socialization of individuals and families within their communities. Religious and cultural activities in communities are centered on women. The highly social role of African women heightens their vulnerability and that of their dependents, the kids and the husbands who actually depend on them, to COVID-19 infection. So the centrality of women to social interactions in communities makes gender mainstreaming of COVID-19 responses imperative to mitigating the spread of the pandemic. When women with pre-existing health conditions are among the most vulnerable persons in the communities, women with HIV/AIDS, with pregnancy issues, with prenatal issues, all of which require urgent access to healthcare. So the already ill-equipped public health infrastructure across the continent has hampered women's access to quality healthcare, and COVID-19 has further limited access to healthcare for women. So this diversion of scarce resources, healthcare resources to address COVID-19 has posed a particular challenge to women who need urgent medical attention for non-coronavirus medical issues, just like Sonia has touched on and Honorable Minister has also touched on that. Gender-based violence vulnerability posed by COVID-19 is multidimensional. If you look at the closures of schools, for example, as part of the lockdown measures, that has a negative implication on girls' education. Imagine that in Sub-Saharan Africa alone, we have more than 120 million students out of school. And these girls are at risk of social threats because they're not going to school. So they're in close proximity with people who abuse them, including mistreatment, exploitation, sexual and gender-based violence, and teenage pregnancies. So, we recall the same scenarios during the Ebola outbreak in 2014 and the Millennium Promise Project with the 1 million CHW campaign has done a lot on that. We saw how women and girls had to carry the burden of the Ebola outbreak. And if we're not careful, we will see the same pattern in times of this COVID-19. Human security is under threat in times of COVID-19. When you look at the health sector, education, food and security, political participation, all spheres of development for women is all even more compromised for women in times of COVID. Let's take agriculture, for example. The economic impact of the coronavirus pandemic on women is cause of concern. Women are key players in African economy, especially in agriculture. About 89% of women in Africa are employed in the informal sector with low income and no benefits. Also, women provide more than 50% of agricultural labor in Sub-Saharan Africa, which is the highest proportion in the world. About 70% of Africa's food is produced by women. Women are key agents throughout the whole agricultural value chain, including in processing, in preserving, in marketing of agricultural products, and taking the foods to the markets and selling them. They are also economic agents, and they are owners of small businesses, such as grocery stores, roadside sellings, and other petty trading to support their household income and livelihoods. According to the World Bank projections on the COVID-19 pandemic impact, there's going to be a slowdown in Africa's annual economic growth by 3.2%. From 3.2% to 1.8%, a big difference, more than half. So with all of these mentioned above challenges, gender-based violence and women economic empowerment is of critical importance. In times of crisis, when resources are strained and institutional capacity is limited, disproportionate impacts with far-reaching consequences that are only further amplified in context of fragility and emergencies. Gender-based violence has exacerbated during this pandemic. Economic and social stresses combined with movement restrictions and cramped homes are driving a surge in gender-based violence in Africa. Prior to the pandemic, it was estimated that 1 in 3 women will experience violence in their lifetimes, a human rights violation that also bears an economic cost of $1.5 trillion per year to governments. So many of these women are now trapped at home with their abusers and are at an increased risk of other forms of violence, as overloaded healthcare systems and disrupted justice services struggle to respond to their needs. According to UN Women, emerging data shows that a deeply concerning trend, which is that the COVID-19 is driving a spike in domestic violence and is being compounded by money, health, and security stresses, movement restrictions, crowded homes, and reduced peer support. So domestic violence reports have surged upwards of 25% in this last quarter, since the not social but physical distancing measures have been enacted. In terms of gender, peace, and security, COVID-19 spreads, there is an urgent need to stop conflict. Building on a call from an immediate global ceasefire from the UN Secretary General, which was last April, I believe, he appealed to end all forms of violence everywhere, from war zones to people's home. Violence was before in war zones, but we are now seeing more violence in people's homes than ever before. And he is appealing to governments to focus efforts on ending the pandemic and ending all forms of violence against women. If you look at refugees camps, for example, where you have cramped conditions, living conditions, this makes physical distancing challenging. Women and girls are more prone to gender-based violence when practicing hygiene at the latrines that they have to use outside when they go to the bathrooms, or even when they go at the water distribution sites to get water. So conflict, humanitarian crises hold women and girls back from progress, including the right to food, as Honorable Minister said, to education, to safety, health, and social economic benefits. Imagine that all of these existing human security challenges and development issues were already in existence for women. Adding peace and security dimensions to the pandemic further exacerbate the vulnerabilities of women. Women must be part of the solution. Evidence shows that when women are included in, for example, peace agreements, they're more likely to be durable because they take into account women's specific needs. When a girl is educated, it has strong economic gains for the whole family and the whole community. And this is not just mere statement, but it's scientific facts. In a COVID-afflicted world, we cannot afford to leave women and girls behind. If governments don't act fast, the effects of the pandemic could roll back the limited progress that we have made in gender equality, women empowerment, peace, security, and sustainable development. So in sum, in achieving the Sustainable Development Goals by 2030, with the COVID-19 now in the midst of everything, or any new future global pandemic, because there will be other global pandemics, it will require us to ensure that women's specific needs are taken into account to ensure sustainability at all levels, ensure peace and security, gender-based violence prevention, as well as ending all forms of violence and discrimination against women in the fight against this global pandemic. Thank you.
Thank you very much, Uli. I think, you've done it in a so fantastic way that I don't know what else to say. I think you have really made us all proud. The work you've done over the years, peace and justice for women has been so exemplary. I didn't want to let your head be swollen because you are still young and you have more to do. And I want to congratulate you on your new position, which I'm going to share that office with you because I want to be in Kigali too. So thank you so much. Thank you so much. And I want to open the floor at this point for any questions that you may have for Uli, gender-based violence, peace, and women empowerment. And I can see that when you look at the panelists from the Honorable Minister to Nancy Best to Sonia, they all fit so well into what you have described, and it's very important that we try to, knit all of them together so that we are able to create sustainable and peaceful environment to support the empowerment that we try to give to these women. Because you can empower them, and if it's not in a sustainable way, like Nancy said, then you wouldn't have done much help to these people. So it's important that we get it right, like you put it. We are so proud that you've been able to enlighten us on this one. So I don't know if there are any questions from Sonia, Nancy. Do we have questions for Uli? If not, yes. Sonia, do you want to? Do you have a question?
No, I wanted to just first of all congratulate you for your presentation and also commend you for many years of unbelievably important front of line work, and share your frustration that we were already working in a very difficult environment. The situation was already so difficult, and we were all pushing and hoping for progress. And now there's this new wave pushing us all back. And so I think it's actually yet another dimension that's important from this convening, which is that, we really also need to continue to talk to each other to boost up our morale, because it is frustrating, actually, because, everything now is even harder than 8 months ago. In your field, in Radhika's field, in all of our fields of effort. And so I just like this community because one of the things that we serve, besides in keeping each other abreast of other issues that I, for instance, don't know as much about, in addition to that, it's also the camaraderie of this collective and our efforts. Thank you, Uli.
Thank you very much, Sonia. And it's so sad. Sometimes I listen to some of these and we have a lot of discussions. How best will this digital device, that we have in terms of the women to their knowledge base on ICT. And now they are having to, you imagine a market woman who is supposed to have, because of social distancing, they're supposed to, do all of these online stuff and all of that. How are they going to manage that with the knowledge that they have that is already in a deficit? So it's something so hard and so difficult, very challenging. Yes, Sonia, go ahead.
Can I
yes.
just make another point that I should have, sorry to interrupt. In the United States, I sent an article yesterday to Chief Nat. In the United States, there is a serious attack, obviously very small scale compared to the issues that you're talking about, Uli, which is, half the world are women, and a huge percentage of them are under attack. So it's not that scale, but still, there is an attack on public health workers, on outreach workers, and most of them are women. And it's really something that you need to be prepared for also in Africa. Here in the US, everything is sort of exaggerated. But in fact, there is a major, even Dr. Fauci's family, it says, this article said, his wife and daughter are now being protected because they're being threatened because of people being angry at what Fauci is advocating, which is the right things that he's advocating. But so there is this new thing, which is an attack on people who are seen as bringing bad news and making us do more things. And so that's another reason, by the way, why we have to hang together, because our voices are not necessarily welcomed by the larger community. Thanks.
Great. And I just read from Abiodun in Nigeria, who says gender-based violence is on the rise, especially cases of rape in Nigeria owing to COVID-19. We need to continue to create awareness and sensitize our people on the need to respect the right of women, which I agree with absolutely. And I believe that this is the reason why we want to do this, and we are going to continue to do this as best as we can. So I'm still trying to connect to my co-moderator who had a small challenge with power, and she'll be connecting back shortly. So Fatima Bosu, as soon as she joins us, is taking over from me, and I'll also do the listening and possibly ask some questions from the fringes. So our next speaker is Radhika. Radhika, I know she's also another modest person. So Radhika, here you go.
Radhika Inyenga, research scholar. Radhika Inyenga has a PhD in economics of education from Teachers College in 2011. Her research interest consists in conducting evaluations of educational programs and international educational development. Radhika Inyenga received a distinction from Teachers College, Columbia University on her dissertation, Social Capital as a Determinant of Schooling in Rural India. Her studies were received in India, parts of which were also printed in India's daily newspapers. She has also presented her dissertation in various conferences like the Comparative International Education Society and was awarded the New Scholars Fellowship Comparative International Education Society for 2010.
Great. So Radhika is going to speak to us on girl-child education and the existing digital divide. So I hand over humbly to my co-moderator, Fatima, to take over from this session. Fatima, are you there?
Yes, I'm here. Sorry, I had connectivity issues.
Yes, you're back.
Yes, so we'll give the floor to Radhika to make her presentation.
Thank you, Fatima, and thank you, Chief Nath. I think this is such an important topic to discuss, and I think we need to have a series of sessions like this, not only to discuss the issue, but also to bond together on this topic, because I think one session will not do justice to this entire range of issues that focus on gender, and it's all these linkages between health and education and empowerment and sustainability and so many different components. I feel that we need to really have a range of topics that deal with this. Today I will be presenting something that I had learned from the Millennium Villages project and continued to learn from it and implemented this in India. And as Sonia already mentioned, Millennium Villages project was a flagship program for at MPA, and we learned a lot in terms of, for me it was a big learning, because at that time I learned that all these different sectors really have to work together, and at that time it was MDGs, and after the SDGs were born, I felt that a lot of the lessons that we had learned already automatically translated into how these things should come together. And now we are mandated with the SDGs that all these sector related interventions need to come together: health, education, energy, infrastructure, sustainability. All these elements are so tied together, especially with a topic like gender. It's even more valid. So thank you for already showcasing all these, my esteemed panelists have showcased beautifully how gender, interacts with health and empowerment, sustainability. Uli, of course, mentioned the entire gamut of where we are and did like a comprehensive overview of where things are in terms of, in terms of gender. So today I wanted to present you some experimental work that we did, an intervention that we did with the district education, district office, one of our districts in India, in southern India, Telangana state. The district is Mehboob Nagar, and where we managed to work with the government to create something that has so many different impacts. And I want to come back to later why this is relevant even during the COVID time, and how we have changed our model for the for the COVID related work. So I want to focus on ICT. Just because when we talk about women empowerment, the first thing that comes to my mind is how are we empowering the women? And to me, skilling of women is something that is really empowering, because it brings in the economic means, it brings in the dignity that everyone needs to have. And so I feel that that ICT component and enabling everyone, and Uli also mentioned 89% of the women in Africa are in informal sectors. I think Chief Nath also opened this session by saying that women have been abused, and so many other things have happened. So how can we make that skilling component so strong that the women are empowered by the knowledge, and especially using an ICT based model is something that we had tried for many years. At that time it was very difficult to even have like something going in our villages, but we achieved the impossible, and we made sure that through our education programs all children were receiving some sort of ICT program, education program, and were getting empowered. With the SDGs, the focus for SDG 4 is lifelong learning. So I just want to focus on the lifelong learning component, that even for us who have graduated from school, and many women who have not been able to be so successful and continue their education, learning has to continue. And in this day and age where there are things are happening so fast, and changes are happening so fast, we need to be abreast with new techniques, new skills, so that we can compete in the economy and make sure that women's contribution to the economy actually increases. So we have different components here. We have an impact on education, employment, gender, health, and environment through this particular model that we applied in south of India. I'll go over the details here just to show a picture. This is actually from my hometown, Bhopal, where we did this with a non-profit with the government's help, where we were able to do this literacy, so education for sustainable development literacy with plastic bottles and plastic related pollution. We were able to showcase how plastic pollution causes harm, and then the women really got onto it and explored many more things and created their own PowerPoints. And these unfortunately many of our ladies who were attending our program at that time did not even have the luxury to go to a primary school, but they wanted to learn computer so that they can learn for their kids homework and for many other things that that is important for us to all learn from. So what happened was that we created this multi-use ICT center in Telangana, which is now scaled up in many places, including Madhya Pradesh state and including other places, where we were able to work with the government. They gave us space, and we were able to have a cyber cafe in the evening, women's safe place in the evening, to just come together and have all these discussions about women's issues and safety issues, and give share resources with each other. And then during the day we were able to run these classes, the ICT computer learning centers and the vocational training centers. So this was something that we did during the day. So what we did, there was a business component to it, and there was a we had energy component, we had a solar powered center. So we were able to use the solar power to not only focus on the environment sustainability, but also use that solar energy to supply it to the communities. And the women would be able to gain some more money from this particular initiative. But we were able to actually subsidize the government office where we were operating from, and the government office did not really have to pay money back to the energy electricity department. So we saved a lot of money from the government's perspective as well. And then we had a smart meter which monitored the different energy appliances that we were using, computers and other things, which we were able to see how much energy we are going to save and how much energy we are going to utilize in community services. In the place where this was located, there was a college there where a lot of it was a residential college where a lot of different rural girls used to come and stay there. And so there were around 400 girls who attended this particular center. It was and then these classes were actually held in the evening after the entire school session was done. So in the evening, these girls would come to our center, and we were able to have this education component run. They would learn computers and other things in the evening. It was a little bit so it was tricky because in the night it would get very dark, and there was safety issues. So what we were able to do was to have these lamp posts that were installed but used our energy from the solar panel. So it developed really a community. Those lamp posts helped to create that safe space in the night and have electricity. Also at the same time, we were able to use the electricity to have a big playground that was close to this, fully functional. So the girls would play volleyball, and they would have fun playing cricket and other things. So we really created a community with the energy component, which was initially we thought that, okay, we will just use it for our own computer purposes. But we were able to create this really nice ecosystem where the girls were not afraid to go out in the evening and go and play, their favorite sport, run, and to get some energy after the entire day, and have a good community gathering in the evening. So a lot of different implications of having that energy component. The idea was to use this mini grid that we had to have a smart meter, and then women would become entrepreneurs and also gain some money by supplying this energy to the communities. The idea was to use use the extra energy that we have to supply to nearby shops for their own business purposes, and the women will be able to manage this particular booth. Of course, we didn't do this whole complete thing. We were able to do much of it, but not really a lot in terms of where we were. And I'll tell you the reasons why, with the COVID and other things coming in. We were able to, as I said, institutionally, we were able to supply energy to the government offices, as well as the energy booths for the community and the cyber cafe for the girls. In the evening was, and then of course our main work was the skilling. So we were able to do all these classes in the morning where they were able to learn conversational English that will be helpful for their jobs. They were able to learn computer typing. Many of these girls actually, even if they were doing computer program, even if they were doing these educational programs in the computer using computers, they really only had theoretical knowledge, and we were able to give them a practical knowledge. And we won't have time to show the video, but they were really hungry to learn about computers and to learn these skills on the computers, Excel sheets, Word documents, really simple things, but they were really eager to get on, learning it, so that they thought that this is their, way of making sure that they learn things that are relevant, will help them for various things. One of the ladies I still remember, and these are all 18 to maybe 24-year-old girls. And so one of them was saying that, I want to write to our district administration that in my village, I don't have electricity. So can they do something about, electricity, and write a letter? And so she was actually able to write a letter on a computer, print it, sign it, and actually give it to the district officer, and it was very liberating for her because that it looked very official, and she was able to type it herself and ask, and it was an empowering thing for these girls. There were many other components that we did in the ICT training component. These are 3 months batches that we ran with complete outcome based learning, that they will be able to learn these particular skills in those 3 months. So a lot of interesting programs, lot of psychosocial support that the girls required. I remember the first day that I went there, we conducted a session. We had this brilliant program that we made, but the girls never really answered anything. They were really afraid of speaking out. So we clearly knew that we really need to start from not just a program, not just English, and not just computers. That was just only a medium of getting them empowered, but there were many other things that were not done. And they so we started with just icebreakers and having all these rapport, and so then we became really good friends. And there's a facilitator there, she's fantastic. We trained her in a different methodology so that the teacher is really a facilitator rather than her being like a teacher and you are the class. And so a lot of different pedagogical approaches were changed, and a lot of mindsets were changed on the role between teachers and students. And so the solution basically was to have green energy, have tons of carbon dioxide saved, and we know our environment needs these carbon dioxide emissions to be reduced. Households were able to access household electricity. There was job creation. We were able to enroll these girls into these jobs, create job market fairs that were able to, and all this along with the government. We, as in this whole system of all the different stakeholders, various different departments of the government, and all of us worked together. There was a women empowerment government. The police superintendent, the higher official of the police at that time was a lady. So she was able to come and do a lot of women's safety workshops and other things. So really an ecosystem there. There were all these gender empowerment, of course, was an outcome, adult youth literacy related work. And also when we had the space and the time for the girls were not accessing it, the women from the offices, government offices, would come and use the computers because they wanted to learn computers as well. So a lot of intergenerational activities that we were able to see through this particular work. Here are some of our girls. As you can see, everyone very eager to learn, everyone very hands-on. They were focusing on a project that was all project based, and all these projects were live examples of the projects, and they were able their live examples from their own environments. It's not only just working on it, but also the skill of presenting what they did and what they will be doing, which was really critical, because they learned the computer skills very fast, but presenting was another whole story. So we had to really work on presentation skills, and in many cases this was probably the first time when these girls were able to present something to anyone. So it was really a skill that we wanted to showcase, and a skill that we wanted all the girls to have. During COVID, the girls went back to their villages. They were all village-based girls who had come to this particular district, which is also a rural district. And so the girls actually started asking our facilitator, Navata, that, okay, when are we going to start our classes? And I am really missing our classes. And when can we, learn all these skills? And they were really missing the education component, which is very surprising, because at least when I was in school, I never really, thought that I will miss my school that much for education. So here was a case where these girls actually started calling our facilitators and saying, please, can we do something? So some of them had, smartphones. Mainly their fathers had a smartphone. So we were able to quickly transform all our program into an interactive, program through so a WhatsApp and use technology to still continue the classes. So our classes really continued. There were many components that we did. Of course, we couldn't do the computer literacy part because it required computers, but we were able to do the English conversation. We were able to do environmental education. We were able to do, other things, job related interview skills and other things that continued during this pandemic as well. So this was an important lesson that we learned, that yes, pandemic is there, but we will find a way, since it was all about interaction and all about getting together and all about having this particular program online. We were able to find various means of getting these children, these girls together. Up till now, it's been 2 years and we've completed education for around 400 girls, 3 months course each. The courses progress with difficulty level. There have been many, this is like a newspaper article about this particular program. It came out in the district. So a lot of different accolades. Our facilitator got the, award for the best intervention in that district from the government, and clearly government was really a big part of what we were doing. There were all these online classes, as I mentioned. Solar energy continues to subsidize the government offices. We are not operational right now because of COVID, but what has happened is that there were other officials from other states who came and saw this particular model, and they have already we've already started another similar one in another state in India. So clearly this is a model that is spreading. In Telangana, in this particular state, what we have been discussing is that this particular center will be like a hub of all the centers, and there will be satellite centers that will be opened in various places, which will include like a photocopier machine, as well as like a other utility machines, fax machines, which will be operated by women. And so clearly this has really become a model where, and also the classes will be run in these centers. So here is a model that we learned from the Millennium Villages, that yes, women have to be really empowered. And this idea actually came from our village in Kigali in Rwanda, where we were able to have these women weavers also get some education, and also the women weavers started their own cooperatives, and we now also have like a computer program, computer learning center. This model of computer learning actually has gone to Rwanda now, with our facilitator John actually working on this. So clearly this model has crossed many continents and has evolved, and now COVID-19 was really a true test for us to see whether this model will survive or not. But we were very heartened by the fact that all the women actually asked for this education to continue, because they clearly saw the demand for it. It has like a gender component to it. There were all these gender empowerment workshops that we did with them. There was also a component of health, where we were talking about health and sanitation related work, menstruation related topics. We focused on environment, of course, with the solar energy, and discussing plastic pollution and other things. And then, of course, it led to women getting employed because they became more confident. It just requires a little bit of nudge. I feel that we don't really have to, do much, but create an ecosystem where they are, where everyone learns from each other, and we already have all the skills. I think there's a big social capital component that we all have. We just need to learn to exchange those ideas and share ideas with each other to empower the other person who's with us, especially during the COVID, especially during this time. And we were able to have a successful model so far. We will see what kind of results. I'm still assessing what kind of results, what kind of competencies the girls have been able to learn during COVID-19. And we hope that other governments in India, including maybe this model is already, we have started this in Rwanda, and maybe hopefully someday we can probably do this in Ghana in some form or the other. And I will be in discussion with Chief to see if this is a possibility to do in Ghana. I feel that TVETs, technical and vocational training programs, have to be. We are in discussion with a state in India where they are taking this model because they want to revamp their technical and vocational program for women and make it much more what do they want to learn rather than the same old programs that they have on their menu list. And so upgrading those and greening those TVETs is really a must, because we need to have these technical and vocational training programs that are good for the earth and good for the environment. And how can we match the environmental friendly skills with the technical and vocational training programs and jobs? That's where we are in discussion with a particular state in India to see how can we match all these three different elements and make it sustainable. We clearly know that there is a market for these skills. We clearly know that our girls are very competent enough to get those jobs. But at the larger ecosystems, we need to really work with the government structures to see how they can change their technical and vocational education programs to suit what the girls need and where do they want to go. So just wanted to highlight this particular thing, and maybe we can have a discussion later on to see whether it could be relevant for Chief's fantastic programs in Ghana. Thank you, Chief.
Thank you so much, Radhika, for this great presentation and sharing this great model. And we are hoping that we can replicate this in Africa, in Ghana. I'm sure that Chief will be able to fight for it to be replicated there. We have one question actually coming from the forum. And it says that India is an enabling environment for such activities. How can we apply the same program in Afghanistan, where women suffer from many factors?
So I feel that there are so many similarities between India and many African countries, including Ghana. In fact, when I am in Ghana, I feel that I'm in India. It's like home to me. So Chief, I need to be going back to Ghana soon. I hope things will, subside soon. Many different, things that you will be surprised. There are many commonalities in terms of education challenges. At least I know I'm very well aware of the education challenges, literacy related challenges. Foundational learning has been lagging in many countries, including Ghana and in India. And I feel that especially discussing gender issues are the same in many countries. You can, Sweden, a lady from America, a lady from Ghana and India will share common issues. And that women empowerment is a common thread that spans across all these different continents. And so I feel that this issue of gender is really at the rock bottom, and we need to really come together as a group to see how we can form these collectives with various different components, like today's session, where we had so many different components discussed today, and all very relevant for education. And I think what we are discussing right now, we feel that this is Africa oriented. I think some of these discussions can go to India as well and can come to the US as well, as Sonia mentioned. So all these issues, I think, cut across continents, and we really need to come together to see how we can, form these groups and make things happen in terms of gender empowerment.
Yes, and I totally agree with you. And as Uli also mentioned, the fact that we have about 120 million students right now out of school in sub-Saharan Africa. And with this digital divide, I think it's a little complex for them to continue their education at this present moment. And yeah, this is going to be a topic of discussion ongoing until we find a solution, or until COVID is gone. So does anyone have a question for Radhika before we move to our next presenter? Okay, I think we will wait until the last session of discussion. And now our next presenter will be Mam Harijin, and she will talk about her role. She's a consultant for UN Women and has her enterprise, and 6,000 women depends on her in Senegal. And so she will talk about the impact of the agriculture value chain and entrepreneurship in this COVID-19 season. So Chief, can you please play the introduction of Mam Hari?
Mame Kari Dieng, a Bretton Woods committee member, recently listed among the nominated directors of IFC for their board members and currently in consultancy with 24 countries in West and Central Africa with UN Women, rural entrepreneurship of women economic empowerment, and fight against poverty. As a true agent of change entrepreneur, she is currently impacting over 6,000 women in her country of origin alone, which led her to the title of Vice President in charge of communication of the Women Entrepreneurs Union in Senegal since 2008, as she has also contributed to the PPP as a preeminent and youngest member of the Presidential Council for Investment in Senegal. Mame Karidien was honored and awarded with the honorific award from the Senegalese government for biocensus action in improving the economic status of the Senegalese women in May 2008. A few months later, the Cartier Women's Initiative Award in October 2008, followed by the African Women-Led Business Award by the Spanish government, Firms Africa Solidarité, and Casa Africa in 2010. Mame Karidien can be considered as diaspora serial entrepreneur, as she is now creating a distribution company in France to consolidate her market positions in Europe.
Thank you, Chief. So, Ma'am, you have the floor.
So thank you very much. And I would like to congratulate all my peers, my predecessors, because the presentations were very deep and very rich. So just to say that in sub-Saharan Africa, more than elsewhere, entrepreneurship is seen as a necessity. In fact, every year between 12 to 15 million new university graduates leave universities, of which only 4% on average will be employees of the private and the public sectors. Entrepreneurship in Africa is becoming a primary issue, not only for young people, but for women in particular. Beyond the variety of statutes, size, and scope of the companies created, notable differences between male and female entrepreneurship have recently been highlighted. Clearly, less likely than men to start entrepreneurship, women have a smaller capital base to start their activity and have a significantly lower chance of benefiting from private investment or venture capital. There are also clear differences in success by gender. Women own smaller businesses which generate lower turnover and grow slower than their male counterparts. The COVID-19 pandemic has a disastrous consequence for SMEs, small and medium enterprises. In Africa, women represent 58% of the continent's self-employment population. However, women-owned businesses are particularly vulnerable to shocks, as they are disproportionately in the informal sector and operate in less profitable sectors. In Senegal, my country, 65% of the companies reported suffering the negative consequences of the COVID-19 on the economy of their businesses, and 45% said that they are now bankrupt. Women entrepreneurs, more than others, have suffered the consequences of the disease on their businesses. And in fact, 75% of the Senegalese women network, of the women work in the informal sector, according to UN Women report of 2015 and 2016. And the confinement measures has led to a partial and sometimes total decrease of their income, while they do not profit from any risk insurance. Although more vulnerable, women have shown an ability to reinvent themselves during these periods. This is how some initiatives have been developed. In response of the COVID-19, we have seen, for example, women leaders that have initiated the making of masks and then organize their distribution in collaboration with local communities, thus transforming an activity condemned to unemployment to a survival activity. Another example, which I have participated personally in,
Sorry, you've gone mute. Sorry, ma'am.
Since when? Sorry. I was saying that another example, I personally worked with UN Women, who is currently implementing a gender-focused response to COVID-19 in providing training to cooperatives in West and Central Africa to produce quality sanitary products to help fight the pandemic while earning much needed revenue during these difficult times. So just to share with you, because sometimes images are more, speaks more than any word, I would like to share my screen with you. Sorry. Yeah, and play a video. It will be just a 1-minute video to show you what we are doing within those trainings. Can you see? So here you see that we use what they have in their kitchens and what they have, the raw material and also the utensils, materials that they have with them, and we train them virtually, digitally. And we train more than 5,000 people within 2 months. So at the same time I was doing the training, they were making it happen at the same time in another part of the world. 12 countries have been trained from West to Central Africa. And here the organization helped them respect the social distanciation, but they're doing the soaps at the same time with the means that they had. Sometimes buckets and pots and plastic molds. So very easy things, using also ingredients that can be found in their environment, such as neem leaves or eucalyptus leaves or carrots or whatever, to make soaps and also to make other products such as gels. This is done. We're done with this video. Let me show you something else, which is a result of one of the women, one of the participants that have been trained. She sent me this video yesterday, where she is explaining her own soaps. See?
Coucou les amis, je voulais juste vous faire partager mes nouvelles créations qui ressemblent beaucoup au Mekako. Ce sont des savons antiseptiques à base de moringa et enrichis à l'aloe vera. Je ne vous en dirai pas plus. Et il est vraiment meilleur contre de l'acné. Bisous.
So she is saying that she used aloe vera and also moringa to make her antiseptic soaps. And we have so many testimonials right now coming from the women, coming from the field, that they are, one of the women said something here that I have here. She said, with the COVID-19 situation, I lost everything. My job stopped and I am sinking. This training is really useful to me, and I can tell you that, thank you very much. This is one of the participants. So the training we were delivering to those women had 3 different objectives. One was to facilitate access for women to the means required to protect themselves from the COVID-19 virus, themselves and their families. The second objective was to offer them expertise adjusted to the current socio-economic context, so that they generate income to compensate the losses they had during this context. And finally, it was to support their long-term resilience after the COVID-19, so that they can contribute to the economic recovery. So just to say that, unlike what was expected, it was astonishing to see that technology was not a barrier, especially in the rural areas. Women were connecting themselves from their cell phones and from everywhere in these 12 countries from West to Central Africa. So we are thinking about after the COVID-19, what will happen? Some recommendation. In the agricultural labor, we know that it is made up around 40% across the African continent. It is made with women, but women have lower agricultural yields than men. The pandemic threatens the worsen inequalities and worsen these inequalities, providing productive inputs directly to women farmers can have positive effects on their economic outcomes. This solution is currently being implemented by IFAD, which is the International Fund for Agricultural Development, with a lot of women cooperatives in Senegal. A second recommendation will be that COVID-19 has shown that we cannot continue to treat the informal sector as if it does not exist. Investing in and embracing informality requires the application of policy measures designed to support and facilitate, not to suppress, women entrepreneurs. Tax breaks, affordable finance, and skills trainings must be at the heart of the governmental and non-governmental programs if we are to move towards people-friendly policies. A third recommendation will be leverage digitization and technology for work. Democratizing access to technology will enable women to take a head start in expanding markets for their products and creating value added, while promoting integration by attracting more players. Investing in key infrastructure, especially renewable energy, as my predecessor said it, is important for continuity and efficiency. And last but not least, promote trade in the African continental free trade area as an imminent action, and a renewed commitment to the Made in Africa to bring opportunity and hope to millions of women across the continent. I can develop more, but I think that these points can be steps, points for discussion. And I thank you very much for your attention.
Thank you so much, ma'am, for a great presentation. And I'm glad to hear that the technology was not a barrier
No,
in
not at
all
all.
of your, and all of the trainings and during this COVID period. I'm sorry, but we have run out of time. So I'm going to keep your Q&A session to the last and have Emma Duncan make a presentation first, and then we'll have questions at the end, if that's okay with everyone.
Amma Duncan. Amma Duncan is a founder of the Fabulous Women Network, the FWN, where she conducts activities which help African women to start and grow their businesses. Through the FWN, she has organized entrepreneurial development events for over 4,000 women and shared life-changing stories of 200 fabulous women, reaching over 10 million people in social media. In 2019, she created Fab Hub Ashanti, a shared office and event space for women in business, which has trained over 300 women, including entrepreneurs, under the National Entrepreneurship Innovation Program. Amma has over 15 years' experience in human resource development and is a founder of Corporate Training Solutions, CTS, through which she has trained over 2,000 professionals. Amma is the author of Yarns of Inspiration I, and Networking Made Easy, an Access Bank W Ambassador, a 2017 Mandela Washington Fellow, with a Master's in Business Administration from the Paris Graduate School of Management and a Bachelor of Arts degree from the University of Ghana. Amma Duncan is committed to working towards an Africa in which women in business are economically empowered to create wealth and impact people.
Thank you. Emma, you have the floor.
Okay, thank you very much. And I want to say thank you to Chief Nat, to Millennium Promise Alliance as well for this opportunity. And also to all our previous speakers, you've been amazing. I haven't been able to take my eyes off the screen since you started. So I have 10 minutes and I want to talk specifically to 3 types of women. I've seen that most of you have focused on the great job you're doing, and I'm really inspired. But I want to speak to 3 persons whom I have been actually in the past. So I'm going to, first of all, talk to the corporate woman with one stream of income, the new woman in business, and then finally to the 5-figure plus woman in business. And like I said, all these are women I have been in the past and then currently am as well. Right, so the first woman, corporate woman in business. And as you can see, I have a fabulous picture of myself. This was taken a few years back. This was at a time when I was in corporate Ghana and I had only one source of income. I was the person who had the nice family, the nice car, the nice home, the nice children. My kids went to the nice school, you know. In my job, I had a managerial role and was supposed to be the girl that people wanted to be. But I was very, very broke. Every month, the salary will come. And even before the salary came, I had finished it. This was my life. I was always, always, always broke. Why? Because I was earning only one stream of income. And I thought that was the only option to me. Thank God my eyes have been opened. I am no more at the place where I used to be. And I remember recently thinking, oh my goodness, if COVID-19 had come at that time, how would I have survived, you know? And I have been talking to women within my network, some outside, who are telling me how things are difficult. And even for some of you presenters, you've talked about that, how for some women, it's really difficult at this time. The company I used to work for before I quit my job to focus on my own business, they had to shut down for a while. I believe they are back in action now, but with limited staff. So how would my life have been like? And so I want to talk to you directly. If you are listening to me at this minute and you are that Amma Duncan before, please find ways to make more money. And it is so possible. For me at the time, I thought it wasn't possible. I was afraid of losing my job. I thought that was my only choice. But now I know better. And so for you as well, I want to tell you that please, please, please find more ways. All this empowerment we are talking about, look, if you have that kind of money that gives you economic empowerment, it's a game changer. So that's the first person. Now, the second person I want to talk to is the new woman in business, right? And I have been there as well, like I said. There are so many different things that we need to do as women in business, but specifically even for the new woman in business. When I started the Fabulous Woman Network, I had never run a new business before. Actually, I had no idea I was even going to start a business, but I had to learn. And I'm in a community of so many other women who are learning daily. You see us on Facebook and Instagram, you will probably think we are whiling away the time, but we are learning. For instance, me being here, I am learning from you all. I've learned from Mame, from Radhika, Sonia, so many of you. And we are always learning constantly because it's the only way to grow. And guess what? We deserve it. We deserve that growth. So, take intentional steps. Take intentional steps go towards growing your business. Some of these things you can do include joining a community of women in business. And I love that the World Bank has revised social distancing to physical distancing. So we still have access to social network. I'm sitting here in Ghana, in Kumasi. Chief Nat is probably in Accra. Sonia is probably in the US, but we are connecting. So this opportunity this event is actually free. So there are so many opportunities to learn. Let's take advantage of them. Get mentored. There are so many women ahead of us who have done amazing things. Like Radhika, Mami, I was just listening. I'm connecting with all of you on Twitter because I'm like, oh my God, all these women are there. Look at these amazing things we are doing. We have no excuse not to do it. If we see that others are making it happen ahead of us, in spite of their challenges and all. So we can learn from them. We can network, which is one of the amazing things for such platforms like this. And then we can read. Like there's so many business books out there available to us. We have no excuse. We cannot say, I don't know, or I don't have access. Have you gone to Google? Have you asked Google what you want? Has Google not given you resources because there are so many resources? Of course, even if you have to spend money, do it. Why not? Don't you deserve it? So this is the message for the new woman in business. Invest in growing your business. The final woman I want to speak to, and as you can see, this is a picture of me at Fab Hub Ashanti, which is our co-working space and event space for women in business, available in Kumasi right now. And the interesting thing is we got this space just a year ago. We ran a few events for women in business, and then COVID came. For the past 4 months or so, we've not done anything in the physical space. But thanks to the online platforms such as Instagram, Facebook, webinars on Zoom and all, we are still able to connect and learn more. Now, for the person who has been in business for maybe 2, 3, 5 years, you've started making your 5 figures, 6 figures, 7 figures, please take the hand of another person, because we are speaking with women, let me just say, take the hand of another woman and show them the way. Teach them how to fish. I loved it when Nancy Best was speaking. I actually wrote it down. Let me read. Nancy said, my goal is to help them help themselves. And I was just sitting here, I was like, oh my God, that's exactly what we are supposed to do. Instead of feeding them the fish, if we can all, even if one person, each successful woman, you take the hand of another woman and show them the way. Imagine the impact we'll be able to make, you know? And I was just thinking about it before coming online. I was thinking, it's actually in our best interest to see other women rise. A couple of days ago, I had a message from one of the women in my community asking for money because she was desperate. She's not asking for money to go and run another business. She's asking for money because she needs to go to the hospital and she doesn't have money. I was like, my God, are we supposed to be broke as children of God in these times? No, there are ways. Other people are making it, and so can we. And if only we can get people to mentor us, coach us, and teach us how to make our own money. Imagine how much independence we can have. A lot of women are actually in relationships that are toxic, but they cannot leave. Why? If they leave, how will their children go to the best schools? They can't even feed themselves. And I'm thinking, look, every woman can actually make their own money and spend it and take that trip to Bali, Dubai, Norway, wherever. We can do all that if only we'll invest in ourselves. learn, humble ourselves and learn from people who have made it. It is so possible. So basically, that's my message. And I mean, before I leave, I just want to, if you're watching me and you are any of these women I have spoken to, think about it. How would your life be if you could create more wealth and impact people? How would your life be, COVID or no COVID? Because actually, even in the COVID season, people are making things happen. People are making money. How would your life be if you could do that? I want you to picture that, describe that, and then put it on your vision board or write it somewhere you see it every day. And let that be the inspiration that keeps you going. Let that drive you. Let that keep you pushing. Please join a community of wonderful women. My own organization, we have a Facebook group called the Fabulous Woman Community, and it's open to all women. We've seen a few men there and we kick them out. It's for women only. And this is a platform where we can learn more about business. We are not ashamed of business. We are not ashamed of money, because you know what? The impact we want to create without money, I mean, I don't want to be coming to Chief Nat's office and say, Chief Nat, we want to do this wonderful training for women, but please, we don't have money. If you don't give us money, we cannot do it. I want to come to you and say, okay, this is what we are bringing to the table. Are you able to support us do it? You know, so it shouldn't be, we shouldn't come from a position of helplessness. We should come from a position of power, because you know what? We have the power. So this is my message for you. I mean, if you're watching on Facebook, Instagram, wherever it is you're watching, you can join us. Our Facebook group is called the Fabulous Woman Community, but you can also connect with us on Instagram at the Fabulous Woman Network. So thank you very much for this opportunity.
Oh, thank you so much, Amma, for this inspiring presentation. Definitely learned from it. Anyone has question for Amma? This is really, really great, actually. Anyone has a question? I think I'm going to hand the floor back to Chief.
Right, thank you very much. It's been so phenomenal hearing all of you say the beautiful things that you are saying. What I'm hearing from you is that, yes, women are not just the backbone, but they can be the spine to support the entire family. They're actually the spine, the pivot around which the family can revolve and can thrive and can survive. And so it's very important that we do this quite often. I'm very, very, very thrilled. I didn't know, I knew I've been working with almost all of you. Amma was a mate at school, and so I know her way back. We met again when she was in corporate world. And so she knows me very well, and I know her very well. I've worked with Radhika Sonia, I've worked with you, I mean, Oli, Nancy Best, and all of you. But what I'm learning today is quite inspiring. And I would like to just take my time to share with you the highlights and the summary of what I've heard today. So in Ghana, the gender minister has just shared with us the government commitment and the way by which they intend to abolish witches' camp in the country, which is very, I mean, it's an awful thing that has been happening in this real, I mean, current dispensation, and turning it into a safe haven. And we are looking at adopting Nancy Best, bakery projects in the country. And then we are looking at professionalizing the community health worker model, again, on the continent, because yes, we have done it in Ghana. We would want to scale it up again. We would want to take it up again, because we need it much more now than ever. Hearing from Ma'am, I was just speechless, because the video you showed, I wish I could speak some French, I could understand some French, you know, je ne comprends pas français. And so it makes it so difficult for me to be able to, you know, but we are going to hook up with you. I'm very happy and glad that you are so talented with, I won't say bilingual, because I don't know the number of languages that you speak. And I am just, you know, handicapped, but we are going to hook up. We are going to do much more of this. We need to empower the women. We need to ensure that we help them this particular moment because they need it now more than ever. Like we all started by saying, we did not have the infrastructures in place. We did not have the systems in place. We have not gotten there yet. We have not empowered them enough to leave them on their own. And then we were struck with this COVID-19. And so it swept us off our feet. Now we are at a place where we have to whistle from the rooftop to the women that we're trying to build and empower and all of that. And so we need to put in much more effort and connect more. And necessity brings creativity. And so I think social networking. So I'm once again very happy that they saw the mistake in saying social distancing, because it was quite troubling for some of us to hear people say social distancing, social distancing. We can't distance socially. We need to right now connect much more socially. If physical, we cannot, connect. So I would like to thank you all for your time. We are going to share the link to the recording with all of you who joined. We are going to make sure that we come out with more or less like a report from what has transpired today, and we'll share with all the panelists. We would want to have your email so that we can share with you for your approval before we make it public. And then we would want to redo this, do this and do it again going forward. So on behalf of the entire crew, a very strong crew from New York office, Millennium Promise, Sam, Travis, and all my team. And then to my co-host, Fatima Bosso in Senegal, and then coming down to Ghana, in fact, Radica, that is the Center for Sustainable Development, who are very close parties. And behind the scenes, we have Professor Jeffrey Sachs, who is always guiding and leading us, coming up with brilliant ideas that is mind-boggling and getting the whole world going agog. To you, Ma'am Carrie, who has blown my head off. In fact, I'm going to worry you a lot, and I pray that you tolerate my, I can be very, very buggy sometimes, but I pray that you tolerate me because I'm coming to you, because the things that you showed me are things that the Minister for Gender would want to spearhead in the country. And I believe in private sector participation. I believe in community leadership. I believe in the queens and the leadership, the opinion leaders, all coming together to empower the women so that, we can have stronger continents to have a stronger bargaining power going forward. We had a lot of people joining the discussion from all over the world, from California to New York, to Nigeria, to Senegal, to all over the world joining us. To all of you, we say thank you very much. It's not easy to spend 2 strong hours and beyond in this current dispensation without you being compensated physically. But like Amma said, and like all of us have said, we've learned a lot from this, and I know that we have been taught how to fish, and we are going forward to create more fisher women amongst ourselves and the network that we serve. Nancy, I'm so proud of you. I thank you for your time. Ma'am, I'm so grateful. Fatima, I'm grateful to you. Radhika, Sonia, Amma Duncan, and the Honorable Minister for Gender. I'm so proud of you, women. I wish, in fact, in my next generation, when I get opportunity to meet God, I'm going to tell him to make me a woman so that I can join you. Thank you all so much for your time well spent with us. I'm so proud of all of you. Sam, I'm so grateful to you and the people behind the scenes. I say thank you. All radio stations, all online, Zion, Felix, and all who pick this feed live. I'm so grateful to all of you, and thank you for your time. God bless us all. Till we meet again. Ciao, 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 ciao from all of you.
Thank you, Chief.
Thank you. Thank you.
Thank you, Chief.
Thank you. Thank you. Thank you.
Thank you. Thank you so much.
Thank you. Thank you. Great.